a steady decline over many years, and it's been accelerated ever since the pandemic, when obviously vaccine disinformation has been accelerating. And RFK Jr. has been fighting against basically all public health scientists who are advocating for vaccinations. American Public Health Association, American Academy of Pediatrics recently, who are advocating vaccines, COVID vaccines for kids. Meanwhile, he's basically slamming and fighting against all these public health and medical organizations. And so what is the public going to expect? Basically, the public doesn't know what to do and is now basically just sitting on the sidelines and exempting their kids and withdrawing their kids from vaccinations. And this will only breed further epidemics. And it may be in the 90s or 80% in some states, but locally, remember, transmission is even more local than nationwide and statewide statistics. They're abysmal. They're below 50% in many conservative communities. So that's just a ticking time bomb.
Okay, now you talked about exemptions. What exactly does that mean? Who can qualify for an exemption?
Well, it depends. Normally, there's religious exemptions or some sort of rare, vulnerable illness exemptions, but it's basically unenforced in many areas where the exemptions are just given out like candy. And so more and more have religious exemptions, and there's no basic accountability that is this truly a religious exemption or just an excuse to not get vaccinated? And as a result, it's plummeted, especially in conservative areas. A lot of vaccine rates are well below 50%, even 20% in many ultra-conservative areas. And with that kind of level of vaccination, you're just waiting for any opportunistic, there's more whooping cough outbreaks, there's more measles outbreaks, there's more outbreaks of many other childhood diseases that shouldn't even exist anymore, and yet somehow they're coming back. And I think that's very worrisome. And now that back to school is actually back in session, and as we approach the winter months where transmission during the winter months is further accelerated, I think we're going to see more and more outbreaks and more children are going to be harmed.
Okay, let's pick up on that because we talked about where we are as a nation. What is the real downside of all this? Break it down for us in simple layman's terms. If you don't vaccinate your kids, they're obviously going to be vulnerable, but you touched on something that I think concerns a lot of people, that things we thought were long gone, whooping cough, things like that are now coming back.
Yeah, they are. And I think people just need to understand the concept of herd immunity. Vaccines protect you like a herd immunity. Pretend you're in a crowded room, and if 95% of the room is immune vaccinated, then the chance of and you're somehow vulnerable or not vaccinated, the chance of the virus skipping across the room to you is very low because 95% of the room is vaccinated. But once you drop below the herd immunity threshold, and even lower, depends on the virus how contagious it is, the herd immunity threshold. But once you're well below 50%, or even 60%, basically the chance of the virus skipping through a crowded room, crowded community, a school, is very high, and that will allows for outbreaks to flare up, allows for outbreaks to get out of control, even though we have perfectly, good treatments and preventions for them. And that's where I'm really worried as we approach the winter months.
Okay, let's talk about misinformation and what are schools, parents doing about this, because people in ultra-conservative areas, you're not going to convince them. And if indeed the United States leading health official says, whoa, I have some real questions about vaccinations, then people tend to listen to that authoritarian figure.
Yeah, it's very worrisome because normally we would defer to CDC, NIH, FDA, and the health secretary for advice. But unfortunately, we led by an anti-vaxxer. Actually, RFK Jr. is the king of anti-vax. He led the largest anti-vaccine nonprofit. And just recently, after the Atlanta CDC shooting by someone who unloaded hundreds of bullets at the CDC, the CDC staffers implored and begged RFK Jr., please stop your misinformation. Yet he is continuing to do so, defunding vaccine research, obviously fighting against American Academy of Pediatrics or advocating and begging
Right.
parents, please get your kids vaccinated. And he's fighting against that. So whenever the leadership is spreading the disinformation and misinformation, we're in a world of hurt. And I think we're entering a very dark times and dystopian world in
Wow.
which our leaders who are leading the CDC and leading the health, department cannot be trusted
Okay.
because they are actually, the disinformation
Right.
kings. They're literally on the inside trying to, basically turn down public health
Indeed.
for the
Eric,
worst.
if there are parents out there who are concerned and they've fallen behind for one reason or another on vaccinating their child, what can those parents do now?
I think parents should look forward towards actual legit public health organizations, nonprofits like American Public Health Association, American Academy of Pediatrics, American Medical Association. Trust the medical associations, trust the public health associations, trust universities that put out these releases, trust basically the scientific body, and trust, personally, many people are turning to Canadian public health authorities, European public health authorities, because their guidelines, their government has not been corrupted from the inside by anti-vaxxers. So a lot of people are looking at foreign, Western country public health leadership, as well as our public health and medical associations, because they know best and have our children's interests at heart the most.